Now that we understand MEDDRA's structure, let's roll up our sleeves and dive into real-world coding scenarios. Think of yourself as a medical detective. Sometimes the cases are straightforward, but others require careful investigation. Simple cases, starting with the basics. Let's begin with the easier scenarios, what I like to call our textbook cases. Imagine a healthcare provider reports that their patient experienced headache. Lucky for us, this is a direct match in MEDDRA. You'll find it as both an LLT and PT, making your coding decision straightforward. Here's another simple one. A patient reports nausea. One concept, one obvious term choice. These are the cases where MEDDRA feels like a well-organized dictionary. You look up the term, and there it is. But remember, even with simple cases, attention to detail is crucial. Always verify that you're selecting the most current term in your MEDDRA version. Now let's tackle the more challenging scenarios, the ones that make medical coding truly fascinating. Picture this. A patient reports feeling dizzy with stomach upset and couldn't sleep all night. 3 distinct concepts here: dizziness, gastrointestinal symptoms, and insomnia. How do we approach this? First, we break down the report into individual medical concepts. Then we code each separately, ensuring we capture the full picture of the patient's experience. Remember, in pharmacovigilance, missing information can be as critical as incorrect coding. Sometimes, you'll encounter descriptions that are less than crystal clear. A patient might report feeling funny. What does that mean exactly? This is where your medical knowledge and coding guidelines become essential tools. You might need to review the broader context, check for additional documentation, and consult with colleagues when necessary. Quality control isn't just a final step, it's an integral part of the coding process. Think of it as your safety net, catching any oversights before they impact patient safety or data analysis. When verifying your coding, check accuracy by comparing the original report against your selected terms. Review consistency across similar cases, and verify you're using the correct MEDDRA version throughout. Documentation is your best friend in medical coding. For every complex decision you make, document your rationale. Why did you choose one term over another? What special considerations influenced your choice? Remember, quality findings aren't just about identifying errors. They're learning opportunities that help us improve our coding accuracy over time. Think about the last complex case you encountered. How would you document your coding decisions to ensure transparency and consistency?